Appreciate it. Since we haven't heard from her this morning, we'll go ahead and get started. If she was around the corner, we'd wait, but and she may be, so we'll see. Got a busy day today, a lot of topics here. We'll get started, Barry, with managing the growth of emergency services.
Can you have a motion to add Commissioner Flowers?
See, I get on the job 1 minute and I forget you already, Commissioner Flowers. Sorry about that. We have a motion to allow Commissioner Flowers to participate virtually.
Second.
Have a motion? Motion?
I vote no second.
Second. All in favor? Aye. Any opposed? Okay, motion carries. You are welcome to join in on the conversation.
All right.
Thank you, sir.
And Commissioner Peters did send a note saying she will be watching and all of this from wherever she's at. So
Okay.
she is engaged, just not here.
Okay, thank
All right.
you.
Well, good morning, Commissioners. And yes, we do have a very busy schedule today. So we're going to jump right in and managing growth of emergency services with Jim Fogarty. And he's on his way up to tell you what that's all about.
Good morning, Commissioners. Jim Fogarty. I'm the Director of Safety and Emergency Services for Pinellas County, and I apologize. I have a little bit of an allergy, so I don't think I have a cold. I just have an allergy, so if I cough, I apologize for that. I'm going to present very briefly this morning, in about 10 minutes, an update on the managing growth of emergency services. There are those that will assume that's impossible to do, and I'm here to tell you it's not impossible to manage the growth of emergency services. We, in fact, are doing it. And we've got a robust program. The department has 4 divisions: 911, support services, and then financial services. But the growth management program is currently directed out of the Fire and EMS Administration, and I've got Director Craig Hare in the back, his team, and Michelle Slowinski. But it's being managed out of that division, but it's really looking at all of emergency services, including 911, including the use of the technology. And so although it's in that division, it's not isolated to that division alone. I'm going to kind of go quickly over the goals of the program. I'll give you some brief updates on the progress that we've had over the last few years. You've heard some of this before, but I'll give you an update. And then we're going to focus in on just a few current examples of what we've got going on. But because of the brief period of time, I'm not going to elaborate on many of them. You should understand that there are dozens, if not multiple dozens, of efforts and programs underway currently that we expect to be successful in big and small ways. So what are we trying to do? Without harming anybody, the Socratic oath is above all, do no harm. We're trying to manage the growth of emergency services to no greater than the growth of the population, while at the same time providing excellent service. Again, we don't want to do anything to discourage someone who's having a heart attack or having a stroke from using emergency service. We want to encourage that. But at the same time, we don't want to have those emergency services assigned to some lesser important task when there are residents needing that. So we have a goal to do that. And we have a couple of strategies and tactics. We are approaching this without emotion, but with facts. You know, facts trump emotion. We're trying to do, to the extent possible, utilizing the existing, there are a lot of existing programs in the county, some in my department, some in other departments, and some in the private world. And so we're trying to utilize those existing programs before we ever support developing any new programs. And we've been able to do that. From a strategy, we'd like to prevent the need for the emergency services first, but if that's not possible, then respond with the most appropriate level of resources. And then if we can mitigate the effects of that response, that's really the strategy that we're using. It involves providing timely information, actionable information to those that are in a position to act upon it, utilize it. It does little good to provide information to somebody that's 2, 3, 4 days old when it doesn't make actionable responses different. And then, you know, generally you can think of that the right service at the right time towards the right issue. And only then, and I don't want to mislead you, only then do I go to my boss, Lourdes, or boss Barry, and say, Barry, we need to add resources in emergency services. And that's really what I want to have you leave here today is we try to think through this before we ever come to the table asking to add resources. We understand how expensive emergency services are. Just to add one rescue vehicle, the ambulance-type vehicle you see the fire departments run, that's $1.5 million a year. That's $4,000 a day. Over the forecast period that we use, the 6-year forecast period for the EMS fund, that adds $12 million to the EMS fund over that 6-year period. So it's not a small amount of money. The Sunstar contractor to put an ambulance on the street for a day, it costs about $3,300 a day. Even our telecommunicators, as much as we've raised their pay, you know, it costs $84,000 a year to put a telecommunicator. So it's, and if money wasn't an issue, if we had all the money in the world, it's not always possible or practical. Most of the fire departments and Sunstar Ambulance have had challenges in staffing with paramedics, so you just can't call up and say, hey, let's hire 25 paramedics, because sometimes that's just not practical or possible. But maybe the most important thing, it ensures that these emergency services are available when they're urgently needed. We've studied a lot of this, a lot of these facts, they're fiction, you probably are pretty aware of. You know, the population is growing. We think it's growing at about 2% in the county. And in order to reduce the growth of emergency services to less than population, we need to know what that growth of the population is. We think it's about 2%. It may be in different cities, slightly different, but we're using 2% as an average. We think, and we know, that there are more 911 calls coming in, and we think, correct, we know that it's taking longer for those emergency vehicles to arrive. We don't necessarily know factually why that is, but we're studying that. And we know that some problems are increasing at a faster rate than others. And part of the growth management strategy is to understand those facts so we can take action based on that data. Now, Michelle and Craig and his team over the last several months have been trying to standardize the data sets. Even within my own department, we've got 3 different applications that track and measure emergency services. We've got, some of this will be corrected with the consolidated CAD project that we've got going on, but we're still 18 months away from that. And so we have to standardize that data so we can make sense out of it, and we've done some of that already. We've made some connections, not only connections within my own department, but within other departments, and we've got good working relationships with human services and traffic and engineering, and you'll hear some about that in just a moment. So we need to really understand what's growing, and it always leads to more questions, as you might imagine. We have more questions that we have answers for currently, but the big question is what can be done about it without harming folks. And you can see just a quick analysis of what the top 5 nature codes, that's, you know, the reasons people call, it's a nature that we put into the CAD system. And the top 3 reasons really don't have anything to do with anything other than the phone rang, and either they hung up before someone could answer it, or the technology hung up on them. But when you get down past those, you know, the top reason people call for EMS is falls, and we're going to talk a little bit about what we're doing about that. And so we've got the ability to understand what's growing and how fast. For instance, when you look at the EMS call volume responses, it's actually interesting that in 2022, the number of 911 calls actually went down by several thousand calls. When I'm talking about, that's all law enforcement, all fire and EMS, it actually went down. But when you look at the EMS responses, they went up. They went up by 5.9%, the responses associated with a down number of call volumes. And that, you know, begs the question, well, just why is that? Why do you have fewer 911 calls coming in 2022, but you have more EMS responses going on? Now, in 2023, I'm here to tell you, we already know that's reversed. We're seeing call volumes today, sometimes 2,300 calls a day. And that's up from an average of about 1,700 calls per day. So 2022 may have been an anomaly. We probably think it is. In 2023, we're on track to really have a record number of 911 calls. But when you look at, you know, what's going on with those EMS responses, we find that the service that we're providing to citizens, our citizen demographics probably are changing. The 60-plus individual is using our services more, meaning they've got more serious medical conditions, and you know that's where the EMS response seems to be growing, and all of the problems associated with the 60-plus age group. And you can see the year-over-year comparison with what those EMS responses are looking like. So there's a lot of different programs that we've got in the works right now, and then on the drawing board for the future. Some of those programs you've actually heard about. Karen mentioned a couple of the programs with her connections with the overdose efforts and the behavioral health efforts, the COSAP program, so I won't repeat those here today. But that's really the interdepartmental information sharing, and the result of that, as of today, someone, before they even arrive to the hospital, has a referral to a treatment provider for when they have an overdose occurring. And so, that's the efforts of mitigate the problem long-term so they can solve the addiction, so they don't have to call 911 another few times in their efforts. But there are other programs that I will elaborate on. I'll mention fall preventions quickly, and I'll mention something about 911 and a few things that we're doing to deal with some of the EMS types of issues. I won't get time to talk about our Health Buddies program. I think you'll hear about that a year from now or so. That's an initiative where there's a 12-week program for the socially isolated and the elderly that really have a medical illiteracy. They really don't understand medical terms very well, and they don't know how to take their medicine. And all of that results sometimes in an overuse or a unnecessary use of 911 because they're not compliant with their medicine. But we have a lot of information that we've been looking at. So I'm going to just talk about a couple of those programs.
Just real quick, because he's not going to talk about the human service areas, but I did want to mention your team, and that includes Lourdes and Karen and so many other people, are really looking at how to provide integrated services, looking at the data to where they target programs and people, and using 911 as a starting point. We know who's coming into the system and trying to get better services targeted, and also provide efficiencies within how do we provide those resources. So data is huge, and they're using that to improve our overall system. And so there's a lot of different initiatives they're not going to talk about around that, but while we talk about behavioral health and all these other things, there's a lot going on in that area that is really advancing the way we do business.
Exactly right. And like I say, we have more data than you have time to possibly hear about, so I can't share that with you. But just one of the programs that we have a symposium scheduled for May 3rd, and this is a symposium that we did about 3 years ago that was very effective. We have about 30,000 fall calls in 911 EMS world annually, 30,000 calls. Each one of those calls is somebody that's injured themselves, and in some cases it's life-threatening. And we have a fall prevention strategy that we know works. When we did this 3 years ago, it reduced the incidence of falls in one particular facility down in South Pasadena by 17%, just by a focused effort. The idea is provide that facility some information on who's falling and when they're falling and why, and adopt some of these strategies to prevent that. Night lights, fall prevention information bags, fun plays like the Denying Gravity play. We know this works, and so we're really redoubling our effort. We had to stop doing it during COVID because we couldn't get into these facilities and it was shut down. But COVID is a distant memory right now, at least from EMS. And so we're getting back out there. And the idea for the fall prevention is to try to reduce the incidence of falls by 10% over the next 12 months. That's 30,000 calls by 10%, so that hopefully we can reduce it by 3,000 falls. Maybe we can, maybe we can't. If we fall short and we only get 2,800, okay, well, we tried. But I mean, that's the strategy. Use the data, provide that information to the place where they can be actioned on it. We've got a couple of other programs. We used to term this complex case, where folks utilize EMS, large amounts of times. In some cases, hundreds of times. And we're kind of reframing that. We're doing a utilization review. We've had interactions with some of the carrier insurance providers like Blue Cross Blue Shield and Molina, where they're calling us because they don't want to pay an ambulance bill 45 times for the same problem. And so we're looking at these cases, these complex cases, and we're finding some commonalities. There's often behavioral health, there's a substance abuse issue, often it's alcohol related, but not always. And so we're finding some commonalities associated with these high utilizer cases, and then we're trying to develop some strategies on how to best deal with them. And it's not an easy approach, and it's not a broad approach. You can't take, because the person who's got uncontrolled diabetes or the person who's got economic challenges and affording a medical, that's a different approach than somebody that's intentionally abusing the system because of, because they want to ride a mid-county in an ambulance because they think it's fun. So we've got a complex case utilization review strategy that we're looking at. The doctors are involved in that. My team is involved in that. And then we have a location-based approach. We see some locations that we go to often. Some of them you're probably familiar with, bus stations and places of public assembly. And the strategies at each of those locations are slightly different as well. And so, if we know at a particular hotel that, we go there a lot for overdose cases, we're working with law enforcement, we're working with the opioid task force to try to develop strategies, not only to address the problem with things like Narcan, but also to prevent the problems by enforcement. And we call that the community of care approach. And then we've got a couple that I wanted to leave you with before I turn it over for questions. And as an example, the 911 utilization review, we looked at how long a 911 call takes. And we said, is there anything that because we get 600,000 of those calls a year, if there's anything we can do that reduce the duration? When we had to ask the questions about COVID, do you have runny nose and have you been out of the country? It added 60 seconds to 70 seconds to our call taking process. We found that we were asking for the address twice, and when perhaps that was unnecessary. So we looked at a couple of things and said, can we ask for the address only once? Can we stop asking those COVID questions now because it's no longer appropriate? And we were able to save 70 seconds off of those 600,000 calls. Now, that may seem like a minimal amount, but when you do the math, 70 seconds saved on 600,000 is 10,000 hours of employee times that they don't have to answer those phones. That's 5 employees. And when you're strategizing to figure out how can you answer those phones in 10 seconds or less, adding 5 employees without having to hire 5 employees is really a good strategy, and it's been a successful strategy. Our average duration went from 190 seconds down to about 130, 128 seconds, depending on the day you measure it. And we've got more to do with that. Currently, we're looking at, you saw the first slide where there's a lot of calls that are abandoned, even before the phone rings at 911, out in cyberspace. And we're looking at why that is. We've got an abandoned call study going on. And we'll formally find out why. Not easy to do, but we'll formally find out why. And only then will we know what, if anything, can we do about it. Not sure we can regulate Verizon or Sprint or because, their towers are their towers. But we can understand it, and then we'll know what strategy. We do know on the EMS side, response times are going up. We know that along the beach communities and the East Lake Corridor and Gulf to Bay. We know response times are increasing. They're still within the 7-minute and 30-second, but there are areas that are being challenged. And so we've got some pilots going on, and I don't have time to get into the details, but we've got a cooperative relationship with Public Works. Kelly and Tom Washburn over there are allowing us to partner with them and use the intelligent transportation system to best advantage. We've got a pilot going along the East Lake Corridor where there's 8 to 10 intersections being outfitted with new traffic preemption devices that we think can save 15 seconds with every intersection they have to pass through. And on the average emergency call, there are 6 intersections. And so if we can save 15 seconds on 6 intersections, you're talking about maybe a minute with traffic preemption. But it's not just that simple. We don't want to cause traffic congestion. Traffic preemption, we have those signals, and the system that we have in place known as Opticom had some of those challenges. There's a newer system. We're testing it. We think that it'll work. We don't know that it'll work. Again, we do this with facts and data, not emotions. But we think that it'll work. We think that the new system, which uses a sort of a GPS positioning sensor of the vehicle as opposed to the old system that you had to get within 300 feet of the traffic signal before you would take control of it. So we've got that going on. We've also got a live 911 pilot going on. It takes several seconds for us to get the address and ship the call. We have a pilot that allows the crews in Tarpon Springs and Safety Harbor and Pinellas Park and City of Dunedin. They're listening in to the live 911 call right now. If the call is in their district, they can click on it, they can listen, they say, oh, that sounds like a heart attack. Let's move to our truck and perhaps we can save several seconds, maybe as much as a minute in response times, just because they get the call before they even know that it exists. And the sheriffs and the law enforcement community have been using this for a number of months now, and they've actually shaved some time off of their response times.
Before you move off of that, Jim, real quick, back to the data-driven focus group. Data-driven focus group is an invaluable tool that they utilize, and that's all the chiefs, Craig, and people coming together and really looking at the data and all the different strategies on not just growing the system, but having a more efficient response and finding efficiencies in how you do business, not just necessarily always growing. the business. And so it's that group that gives us advice in terms of strategies, and they've endorsed the process that we use and the data that we use to be able to make some of those decisions. So that group's really, really important in this overall process.
You're exactly right. We have lots of robust, sometimes friendly, sometimes not so friendly discussions at that group, but it's always with the intention of improving things. For instance, there was a fire chief that told us, hey, we've got a challenge along Gulf Boulevard because traffic sporadically backs up. So we have traffic engineering looking at when does the traffic back up and where does it back up? And is there a strategy that we can use to overcome that without necessarily building a fire station or adding a $1.5 million medic unit to that? But really, I'll stop there and answer any questions you might have. I want to thank my team for the work they're about to do and the work they've done, because I think we've got a lot to do and we've got the right people in place to do it. So I'll stop there.
Thank you, Madam Chair. And if you mentioned this, I didn't hear it specifically, but talking about the reduction of the calls, are any of our partners really out there with the paramedicine concept as far as the frequent flyers and preventing the next call? Are we really going deep into that yet?
We are. It's a challenging question because when you say frequent flyers, there's many and varied reasons people call us a lot. And so we do have partners. The city of Pinellas Park has a quick outreach program. They've got a community paramedicine program. We've got ideas about a nurse triage line that maybe in the center we can look at that. St. Pete's got some outreach going on. So we've got a lot of those programs in place. That the devil is in the details because, number one, you have to be careful of sharing individuals' protected health information. And in some cases, you don't want to discourage legitimate use. And so someone who's got, often there's multiple problems, the next problem isn't always exactly the same as the previous problem. So that's the big challenge. Someone who's got a substance abuse problem can still have a heart attack. And we want to make sure that we send the right resources. So yes, we do have programs out there, but more to come.
And then just as an FYI, the Area Agency on Aging of Pasco Pinellas received a $3 million ARPA grant for home improvement type issues, and we're basically doing it for the bath to shower conversion and the grab rails and the ramps. And so those kind of improvements will allow seniors to stay in their home longer, but hopefully avoid some of those fall calls that you're getting.
They will. Like I say, I'll mention, I don't have time to talk about the new program, Health Buddies, but just Monday, Craig led a leadership group on what will be a Health Buddies program. Again, this is a group of volunteers, which already exists. It's not a new program. So if you have somebody that's just, somewhat medically illiterate in terms of how to manage their own care, this group will help them through that program. So they don't drive themselves to a point where they have to dial 911 to get controlled medication. St. Pete Fire Department is going to be a pilot program with that, and we expect to roll it out here within the next 30 days.
Thank you.
Commissioner Eggers?
Yeah, thank you for the presentation. And I think having gone through COVID in the last 3 or 4 years, I'm assuming we now have addresses of all of our facilities, nursing homes, assisted living, retirement homes, and we obviously have the libraries. So that should be a database and a source where any of these programs, I'm sure, would be gladly received into their lobbies for educational purposes. And we ought to be able to mobilize on those, because really it's that falling part that you're talking about that creates so much havoc. And many of them are preventable. And that's what we find, at least some of the work that they've done up in Dunedin with the senior group that they have. And it's just so many of them are preventable. Many of them you can't do anything about, but most of them you can do something about. So education, I think, is the key, and being able to immediately mobilize information to those groups so it doesn't take months and 6 months or a year seems to me something we ought to be able to do rather quickly. And that was just a comment. And the other comment that I noticed, I love the idea of managing growth of government, of the EMS. I think it's something that we need to be thinking a lot about, whether our folks up in Washington are managing that growth in government or at the state level or here. I think it's something that's scrutiny on every single program that we have, and understanding what residents need and want and what they'd be willing to sacrifice is always important. So I like the approach that you're taking on this. I think it's really important, especially with an overburdened system. We've got to figure out some relief valves, so.
You're exactly right. And again, I don't want to leave here with the assumption that we're going to be eliminating growth. As the population grows, as the service needs grow, EMS will need to grow. The idea is to grow it only when appropriate. So when I approach my boss and say, hey, we need to add a $1.5 million thing, and he says, why? And I say, well, here's why. Here's what we've tried to do to prevent that, and we've done that. We've delayed it for 5 or 6 years, but we're at the point where we can't. So we're on board with that.
With the increasing cost of labor, it becomes really important that we be more efficient so that we try to keep within that 1 or 2% growth that you're talking about. I mean, it's just the only alternative you really have is to try to be more efficient and effective with our program. So anyway, good work. Thank you.
Commissioners? Anyone else? No? I have a couple questions. I hope I can word them properly. I'm curious if there are specific areas of the county that are incurring more calls than others. Do you know?
Well, it's a tough question to answer because if you say, are there specific areas that have more car crashes? Yes, there are. Are there specific areas that have more overdoses? Yes, there are. Are there specific areas that have more homeless? Yes, there are. Are there specific areas that have more heart attacks? Yes, there are. And it's not a broad answer to that question. So we have the data and we know what's where we know what. We just don't know specifically who.
Right, but you do know, I think I learned this from a conversation with Mark Postma, you do know where those frequencies exist. And so in some manner, shape, or form, they do plan for that a little bit by having vehicles close by, et cetera, et cetera. But the other question that goes along with that is, clearly we see from one year to the next, the growth in the traffic on our roads, and that's got to have an impact on our emergency vehicles as well, right?
It does. It does. It has a dramatic impact, not only on your ability to get to work, but on the ability to get to a crisis call. And again, the crisis call is the key call, getting there within a few minutes so somebody can do something. So yes, that's correct. And partnering with traffic engineering to understand those patterns. I know there was a report last week on some road improvements up in the East Lake Corridor, for instance. They're going to be doing some median improvements. That intersection up there at Keystone and McMullen Booth Road is a hard intersection to get through. And because there's only one north-south road up there, it's a necessary intersection to get through. So yes, we are working closely with the departments, with the existing programs, again, without trying to cause more harm. We don't want to cause 3 traffic crashes because we barrel through an intersection to get to a heart attack.
I had one more really important question that just flew right out of my head.
Let me ask you a
So somebody else asked something, it'll come back if I just get quiet. Commissioner Eggers.
I just wanted to make a comment, and I kind of to your point about I guess the amount of time it takes to get a response vehicle to a scene. I didn't realize for the longest time that not every fire station had 2 trucks. A lot of them only have 1. And so you're agreeing to allow one of the ambulance type services up in the East Lake Corridor. Because of that road, during rush hour, it becomes problematic if somebody's out on a call, that you can't get there because you can't get through the traffic. So having that flexible vehicle that moves back and forth based on which direction the rush hour traffic was, I thought that was just a really good idea. The number of calls didn't justify necessarily, but because of the length of calls, people, the time for one of the vehicles to get to a scene, it was a problem. And so at least, I mean, that was one little solution in one area that we had to think outside the box a little bit, and I really appreciate that.
Right, and those changes have been made. We've added a transport-capable truck in Tarpon Springs. We've got one that you were just there, helped us pushed into Dunedin. And so, yeah, our system really does add resources, but we add them when they're really necessary.
But they also do it in conjunction with partners in the area. So if everybody tried to address that, well, then you're losing that efficiency. they're also looking at pre-positioning things. If you know traffic's going to get bad during a time and it doesn't have, like the Sunstar, they set at a gas station up in an area, they don't necessarily come out of a centralized point. And so looking at the data, looking at the traffic and making those decisions to where you have an efficient system is important. And they're looking at all of that. And I think it's it's so important because just adding more is the worst financial decision you can make. You may have to make it, but try all the other alternatives first.
I remembered. Thank you, Commissioner Eggers. Thank you so much. Okay, so it's kind of a multifaceted question, but for those of us that have been working on fire and EMS issues for decades now, you know that calls, in the minds of the chiefs, calls equal money into their budgets. That's the way it's kind of always been, right? I'm right, right?
He's nodding.
Well, no, I think you have to, if I were a fire chief, which I'm not a fire chief, but if I were a fire chief, I think their goal is to protect their citizens in their districts. And so the more protection, the better. So, your point is, run, call, get paid was a strategy that was in this system years ago. I don't think that's been in this system for a very long time, the run, call, because ever since the data-driven focus group, they look at it and say, okay, we're running a lot of calls. Can we run them in a different way? We instituted priority dispatch, not countywide, but in the cities that it's been instituted, there were 5 cities. It's been remarkably successful. And the city of Largo, the city of Clearwater, the priority dispatch really targets the right resource to the right call.
And I hear what you say, but I do question that that's the way it used to be and that isn't still lingering today, based on some of the conversations I've had with some of the chiefs. And so that leads me to my next question, which is, are the chiefs countywide informed about the focus that we're putting on data versus emotion?
Not only are they informed, but they're part of that discussion and decision. It's not like the county's telling the chiefs, this is what we're kind of doing. They're part of the, when I talk about the growth management, the fire chiefs are not separate and distinct from that. They're part of that. We have to capitalize on their fire prevention programs and their community paramedic programs. So they're part of that discussion. Now, it doesn't mean they all agree with the strategies and the tactics, but you can make that case for, your generic structure fire, that some people want to put a hose in the front door, some people want to put a hose through the window. So there's different tactics that the different fire departments and fire chiefs have. But on a strategic basis, I think they're all on board with the approach to try to manage the growth.
That's good to know, because I know that they had that focus group and the data-driven group a while ago. I just didn't know if it still existed.
It still exists.
So
It still exists, and that's exactly what Jim was talking about, and I mentioned before. They come together as a group. You can always find a differing opinion, but as a group, they use and they talk through all these options. And the strategies that they're employing, that they're bringing to you, have been endorsed by that group.
Good to know. Thank you so much. Great presentation. Any more questions, members? No? No? All right, thank you, Jim.
Okay, next up, Commissioners, Chris Rose is on his way up, wherever he's at. And the long-awaited discussion about our reserves and our reserve policy. So he has a presentation for you.
Good morning.
Good morning.
We're joined also today by our Clerk and Controller, Ken Burke, and he'll be part of this presentation.
The keeper of the checkbook.
Yes.
Even better, he's going to go first. So
Well, all right then.
you trust me with the remote?
Sounds good, Chris. Why don't you sit there to make it a little easier?
Do you want to go to the podium, Mr. Burke?
No, I'm going to stay from here if that's fine with you.
That's fine with me.
And first of all, I want to thank you for the previous presentation, since I'm in that over 60 category, express, very interested, the highest use. Let me start off by saying, the clerk's office is probably the constitutional by design that works most closely with the Board of County Commissioners. We have Teresa here today as our board reporter from the clerk's office to independently take care of the record here. Barry and I work very close together. We have a great working relationship, and I thank you, Barry, for that. And our finance division of the clerk's office and OMB have to work together. It's a marriage. Like any marriage, it has its ups and downs to it. And I want to compliment Chris. Chris has been a good spouse since he's been here with our finance division and collaboratively working. And I think today's a demonstration of that when we're dealing with reserves and fund balance, it involves the Office of Management and Budget, but also involves the clerk's office. And so that's why we're jointly presenting today. And we have Jeanette Phillips, who was our director of our finance, and Bill Seither, her right-hand person, especially in financial reporting. So they're here to my lifelines. If you ask me any really tough questions, which I can't answer, they can. But before I get into fund balance and reserves, your chair asked me a question the other day. We were at a meeting together on Tuesday, and she asked about FEMA reimbursement. And we got some figures for you as far as how long it takes. Hurricane Irma, which happened in 2017, there are still monies out there to be reimbursed to the county. It shows you how long this process lasts. And again, it's a joint effort between the clerk's office and OMB in making this happen. But I think the significance of that is that we're still owed approximately $6 million from FEMA for past hurricanes and past events. A lot of it's from last year's, $3 million of that's just from last year's hurricane, which didn't hit us. But the one that didn't hit us, but the Irma, which did have a more impactful on Pinellas County, we still at the time expended over $20 million. And I think that's significant for something that was not a direct hit, and $20 million went out. So it shows you the need for having cash reserves and that's the part of the discussion today, because if that was a direct hit, you just say, what would have been that amount needed? And I've talked to my colleagues in Lee County and Bay County, and they had some serious issues, and they had to go and borrow money in Bay County. I don't want to speak for Lee County because I haven't had as much communication with them but Bay County had to go out and borrow money because they didn't have the adequate reserves when you're in a situation like we are and have a coastal county. So go ahead.
May I ask a question while you're?
Sure. Yeah, and that'd be good. Let's not have questions at the end. Let's have questions as we go along the presentation.
Yeah, because I'm afraid I'll lose my train of thought, and I don't.
That's what we're hoping, Janet. Just.
And I don't want you to lose yours. But my question is, we are having the same kind of an issue with another federal agency that kind of operates under the same. They're out there anonymously, and they don't report to anybody, and they don't have any accountability. So my question is, what are we doing to try and collect that money, and why is it taking so long when we know they have the money?
Why? It's because it's the federal government, and it's just the way it is.
Oh, no, that's not a good answer.
And I wish I had a better answer, but this is across the country, and this has not been something new. When I got my eyes wide open when I first became clerk, and we were talking about an event that happened like 8 years before as far as a hurricane, and we were still working on reimbursement. It's FEMA. I can't answer. You would have to go to Congress to get an answer in the federal government. But that FEMA.
And that's what I was hoping you would say.
FEMA is they are very diligent as far as making sure that they're not paying any expenses that they're not supposed to. And we have to justify everything we do. So when we have these events and you say, gosh, why aren't we just moving as quickly as possible, which we do move very quickly, but it's our job at OMB and the finance division to say, hey, documentation, because if we don't have it, FEMA will not reimburse us the money. And as the county, we're the center part to disperse the money, like with the school board and so forth. We're the ones who have to expend the money to the school board and then get the reimbursement for all the shelters. So it is a very complex thing, and they go through a lot of auditing processes in FEMA before they release the money. Chris, do you have any further comments on that?
I just want to add to that real quick. There's different pieces that require different levels of documentation. So when you hear somebody get a reimbursement and that was quick, well, it just depends on what component pieces it is. And that's where it gets really tricky and really complicated. And like Frederica and OMB and others, they're experts at that. But that's the reason you'll hear about some things that are quicker than others without getting into detail.
But again, we for Hurricane Ian, which happened last year, there's more money owed to us than's been reimbursed to us.
And see, that's, so, thank
It's
you.
almost like, a 55-45, and the 55's been owed to us, and the 45's been paid to us.
So that's really important, Ken, and thank you for explaining all of that, because commissioners, especially for those of you that are new, remember this piece that's being presented today when we get to that portion of the budget where we start talking about our reserves and whether or not the percentage, because we get stuck on that every year, and whether or not it's appropriate for moving forward. Oh, good.
And Chris, do you have
Great
anything to add
minds.
with the FEMA before we?
Just to add on to that, we've turned in everything we're supposed to turn in to FEMA. The ball is in their court
For Irma,
for Ian.
for Ian and
Yes,
Irma.
and Irma, oh, yeah.
Yeah, Irma for a long time.
Yes.
But that doesn't mean they don't come back to the table and request more.
They ask things, sure. And just, I've not had the chance to tell you this, but we have turned in the last request for COVID now. So we have turned everything in for COVID, and that is also in their
That
court.
we had to upfront.
Yes, ma'am.
And there's $2 million left unpaid on that.
Yes.
They reimbursed around $4.7 million, but $2 million still left to be reimbursed.
Good to know. Thank you. Yes, Mr. Scott.
Thank you, Madam Chair. Hey, Ken, just curious, what amount of money did Lee County need? And it may, the tab may still be running on it, but
And I'm going to get you that amount. I don't have that. I contacted the finance director and asked for that figure, but I'll get you that as a follow-up, okay?
okay, great, thanks.
Because I'm curious myself on that.
Thank you. Anybody else in the moment?
Okay,
All right.
let's move on to fund balance and reserves. And actually, governmental accounting is more complex than private accounting. If a corporate financial statement is fairly easy to read for even a non-financial person. But in government accounting, because we have enterprise funds, because we have all these restricted accounts, you may say, gosh, there seems to be a heck of a lot of money out there, but that doesn't mean that you have access to those funds. For example, we have a reserve for the health insurance, our self-insured health insurance fund. Well, you just can't use that money if a hurricane's happening. That would be improper. That's for the health insurance reserve. And then you have all these designated funds for all these different entities where a tax fund goes into that particular fund, and there's restrictions on that. You can't spend those monies for other than those purposes. And then you have substantial amount of unrestricted reserves in our enterprise funds. Again, they can't be used for other purposes other than what their balance is for. So we're putting all those aside, and we have like over 30 of those types of funds that have fund balances to them. So I don't want to get too into the accounting, but all those 30 accounts, and some of them are quite substantial, again, with the health insurance and the enterprise funds, have fund balances to them, but those aren't fund balances that we're talking about today, okay? And I'd be glad to, if anyone wants to meet with Chris and I on an individual basis to go over all the different fund balances, we'd be glad to do that, and we have those figures as, of course, the fiscal year September 30th. But go ahead, Dave.
Do those funds have, each one of those funds have policies set forth by a commission, or?
I don't know that answer.
No, they don't. Some,
Like the health fund, for instance, it's based upon it's based on a risk formula, and so you're trying to set aside reserves to be able to make sure that you have, same way we have with like a risk fund, you're trying to set the amount aside. And the health fund is very well covered. So, could you look at that? We could look at that, but not everything in there would come back to the general fund.
Right.
There's all the component pieces, part to go to utilities or whatever, if we drew that down. But you'd have to get into each individual one to look at it.
And Dave, on some there are, like you've sat on the Tourist Development Council. That has a specific fund balance to it, but that only can be used for those purposes, and the board sets those policies on that.
It would just be nice to know what those funds are, what balances they're in those accounts, and who governs those balances, and what they are as from a policy perspective. There's so many of them.
Right.
They're such moving pieces, and I just would it would be nice to have just a sense I don't mean this morning.
But just to give you an idea, there's the Emergency Management Services, the American Rescue Plan, the County Transportation Trust, the Health Department, the School Crossing Guard Trust, the Community Development Grant, the SHIP Fund, the Gifts for Animal Welfare Fund, the Public Library Cooperative, the Star Center, the 911 System, Contracting Licensing Department, the Fire Districts, the Air Quality Tag Fee, the Palm Harbor Community Service District, the Feather Sound Community Service District, the East Lake Community Service District, the Drug Abuse Trust Fund, the Building Services, the Special Assessment Fund, the Community Redevelopment Agencies, the Surface Water Utility, Intergovernmental Radio Communication, kind of gives you an idea, plus the enterprise funds that exist, plus the ones that are internal, such as fleet and health insurance funds.
We can provide that, and Chris wants to speak on this. We can provide that. The main ones, there are some in there that have specific reserve policies. Some are required to have that, some are by policy. Yep. And then, but the main one is, from a discussion standpoint, is your general fund reserve and probably the health insurance fund. So those are the main ones, but we can provide a list. You see the TDC ones as part of your reports, so we can certainly provide a list of those.
Yes, sir. And through the chair, there is an attachment in the Granicus item that has all of those funds and an historical on those, so you can see how it's changed over the years.
Thank you.
There is not a description or a legal on each of those, but you can see every single fund.
Amounts.
Yes.
But
yes, sir.
not what the policies are, what the policy levels should be?
No, sir. No,
Okay.
it's a spreadsheet.
But we can get that as well.
And some of the policies are dictated by outside,
Understand.
by where the revenue is coming from and why it's there, it exists. And then some you all have some jurisdiction over. Okay, so let's get into.
Madam Chair, this is Renee.
Yes,
Ken,
yes.
is
Good morning.
information also, good morning. Is that information also available in the CAFA report?
Yes.
Okay.
It's not as clean as we can give it to you just on a one-page document with fund balances. You would have to go to a lot of different pages in the CAFA report to find it.
Yeah, and there is in the budget book fund pages that do have just about everything. It's kind of got the pedigree of each fund in there. So, but
And I just want to make it clear they're FUND pages, not FUN pages.
yes.
So let's go back to the big concept here, though, and we really want to concentrate today on the general fund and the fund balance. So this chart gives back one. Let's talk about that, because the fund balance is the big fund, and in that fund balance there's monies which are really not in cash. They're not available to you. And then there's the restricted amounts, and then there's unrestricted amount. And the unrestricted amounts are really the amount that you should care about. There's things such as inventories on there, obviously, and prepaids. That's not something that's not where you can spend some money. It's already committed. And then we have restricted fund balances, where if a person makes a contribution to the county for the animal, it only can be used for that purpose. So that's not available to you. And then there's a assigned fund balance, and this really happens at the end of the year, where all the things, the bills that are in process of being paid and commitments which have already been made, which you can't change, those are committed funds. So those all get deducted from the fund balance. And so it leaves what's called unassigned fund balance. And that's really the part which you as a county commissioner and you as a body have the authority to determine what happens with that. That's basically your savings account there. And then in that, we divide it into two categories: the amount that you budget through the budget process for reserves, okay? And then whatever's left above that is just unassigned. You could assign that as part of your budgeting responsibility. And that really gets into this next slide really gives a snapshot of what I'm talking about. The top, which is the small amount, the 617,000 is the inventories and things like that. Obviously, from your total fund balance of $242 million, that part's the part that's in inventories. The 53 million is the part that also is committed already. We're basically have spent that, but it just hasn't gone out the door, and so that's the 53 million as of September 30th. So that leaves the two amounts which are the unassigned fund balance. You can almost call those amounts reserves, okay? See, reserves are a subsection of fund balance. The 156 is what you have budgeted as your reserves. That's at 20% of the 21% of your revenue that you have allocated as reserves. The GFOA, the Government Finance Officers Association, recommends nationally, without regard to what your county looks like, a 15% reserve policy. We're at 21%. We're a coastal county. Okay, and that's why in a coastal county, you designate additional reserves over a county that's, you know, in the middle of Kansas or Iowa, which is going to face the things that we face here. So if you ever hear at a Florida Association of Counties or a NACO meeting, 15%, well, that only applies to counties which I think would have a fairly minimal risk exposure. For a county, which again is a coastal county in Florida, that risk exposure is greater, and that's why your Office of Management and Budget has recommended higher reserves at 21%. If you were to add the 32 million, which is out there, okay, and available, your total reserves are in reality 25%. Okay, you designate a certain amount as a budgeted amount, and then the additional amount is the 32 million at the bottom there of that chart. So if you add the 156 and the 32, that's 188 million, and that would represent approximately 25% reserve totally. 21% is what you designated, 25% total. You want to go to the next one? Let's go back to that slide. That slide is very important to y'all because that's basically, I think, the question that you're asking today is that how much is available to us as reserves?
Yeah,
Yes, Mr. Akers.
yeah, I think that's the important part because what they tell us is the standard policy at 15%, and you talk to certain people that aren't here any longer that said maybe you should go to 16 or 17%, but that's a policy decision that we've got to make.
Yes.
Yes, sir.
That's number one and the most important. What policy level do we think should be there? The
And Dave,
frustrating.
let me just interrupt you a moment. Just again, that's one of the reasons that the FEMA question was so good because here on a hurricane which did not hit us directly, in Irma in 2017, we expended $20 million, and that was 6 years ago. Just think about inflation and think about a direct hit. So that kind of puts that 188 million in some perspective.
Yeah.
And
Well,
Commissioner, we're going to go, in Chris's presentation, we're going to go and talk about the policy before you and those reserve levels and some thoughts on that.
Well, yeah, for me, it's important to have this conversation because there's nothing more frustrating than when we get into the budget process and that number starts to move around and we start trying to argue points about it and it's just a personal opinion from 4 commissioners that are sitting on the dais versus 3 or 2 or 1, whatever it is. And I think it's important that we understand what that is and what level we agree on, but then don't just keep incrementally saying, well, it was 23, now and that's up to 27 and a half. And there's an argument to be made for that because we can do that until we have 35% in the budget. So I think it's important to understand what standard is, understand what risk, because those Midwestern states, I hate to tell you, they do get not hurricanes, they get tornadoes, and they get flooding, and they get all that stuff. So they have their issues as well, where they have to front money, then get reimbursed the same process. So 2 reasons. One, to understand what it should be, and I think that's something that we collectively come up with. And the other is just not to have a moving target when we're trying to have good conversation about policies as it relates to millage rates, and that's a frustrating thing.
And I think Brian's question was very good about Lee County because that will help too give it a barometer of like how much money they immediately needed to expend in order to take care of their needs.
And I think that question is the most important one for today's discussion as well as moving forward, because that standard that you talk about, Mr. Clerk, from the national focus has been the same standard for as long as I've been on the county commission, and we all know that cost is increasing, inflation is, a lot different today than it was in 2012 when I was first elected here. And so I am really questioning that standard given the place we are in the world today. And as Commissioner Scott said, that storm that hit south of us was originally scheduled to come right here.
Yep.
And imagine whatever the cost is that they needed immediately, I have to think ours would be quadrupled from that, given how built out we are.
To that point, again, I hear you, what you're saying, and if we get 3 Category 5s in our state, we're in a lot of trouble. There is a borrowing ability. This county has very little debt, so if we have this cash on hand, but there is borrowing ability that comes into play as well if we ever get into a real pickle.
And Commissioner, you bring up an excellent point, because we currently do not have a mechanism to immediately borrow. And that's something which I know other counties have, as a result of hurricane problems, have established some types of lines of credit and so forth with financial institutions to have that cash available when they need to. And this is part of the learning process for me too, as we go along, to find out like what, the aftermath of a Lee County, what were the lessons learned from what they're doing. As a matter of fact, their clerk's going to spend 3 days here in the first week in June with me. So we'll have a lot of opportunity to talk about that.
That's great.
Well, can you talk with them also about what are the best practices with regard to a financial policy as it relates to the bonding issue?
And again,
Commissioner, we're going to specifically get into the policy under his presentation, and we're going to show you the other counties and what they're doing. That's all part of this presentation.
Okay.
So let's skip that next slide and go to the next one. Because this shows gives you a picture of our revenue and how we determine that percentage. And you see the 21% is the current budget reserve, although in reality we have 25% when you add the unassigned reserves there. And that's it. I'm going to turn it over to you, Chris.
Well, thank you, Mr. Clerk, and thank you to you and your staff. It is a good working relationship. I'm going to go a little faster. The clerk has stolen some of my thunder, but I'm gonna fill in some gaps here. So, why do we have reserves? We've already talked about it a lot, but counties, states, cities, businesses, households, we all know there's a good idea to set aside something for a rainy day. And, it's in the budget, it is in there, but it's not an expenditure. So when I'm out in the community and I'm explaining to a homeowners association or something what's in the budget, I'm very careful to say, we have a $3.7 billion budget. 2.7 operating, yes, sir. And then, so, yep.
Say that again.
So 3.7 billion operating plus capital in fiscal year 23, yes. So $3.7 billion, which includes our reserves. That's what I'm very careful to say. We don't spend every one of those dollars that are budgeted. And so it resonates when I get out there. People understand when I say that. So next slide is it's how do we develop our reserves, right? It's normally done over time, and it's normally done on purpose. There is some serendipity occasionally, but it is normally done on purpose. Why? What are the benefits of the reserves? So we've touched on a lot of this already, but the improved financial stability of knowing you have something in the bank, the enhanced creditworthiness. When Moody's, Standard & Poor's, and Fitch look at us from a distance, this is one of the key drivers of what they're looking at us on. The improved planning, just to know that you have something available, it's easier to plan the future as you look at it. And something new that's emerging in local government finance is the idea that reserves are a way of managing risk. Sort of, I hesitate to say it, but sort of our own internal insurance policy. If we know we've got something in the bank, that helps us manage the risk that's in front of us. So, this is the policy that we've been talking about this whole time. GFOA, Government Finance Officers Association. They suggest, they don't mandate, but they suggest policy to all governments, including federal, and they're international, they're all out there. Their policy recommendation is 2 months, which is, of course, 60 days, which is 16.7%. That is their recommendation for governments, local governments out there. They give you a choice of revenues or expenses to do it on, and they recognize in their policy that governments may wish to have a higher amount than that. They do not recommend going lower than that. So we went out and did our own research. We're looking at all the different governments that are generally peer governments of ours, similar in size and nature to us, and some neighbors as well is what we've got on this list. We're at the bottom. You can see our policy at the bottom, not in ranked order, but everything else is in order from basically smallest policy to largest policy. You can see Orange and Palm Beach are a little smaller than the recommendation from the GFOA. You can see Polk and Pasco are right at the exact 2 months, 16.7% the GFOA recommends. And then you can see Sarasota and Hillsborough a little larger. Sarasota has recently reduced theirs. It was 90 days, 25%. They have recently reduced it to 2.5 months, so 75 days, which is 20.8%. So our current policy was set in fiscal year 11. It set us at 15%, and that did recognize that we are a high-hazard coastal county. GFOA did not have this recommendation out in its form at that time. So GFOA has come out with it since. So what that is, it's the same number the clerk was saying, 156.2 million or 21.1% is what that is set at, what the actual is today. All right? That's above that. And the next slide is just a visual of how we've gotten to where we've gotten. And then I'm going to go to...
And let's go back to that slide
Yes,
real
sir.
quick, Chris, because, it's kind of, how did we get here? And we were here when we didn't know what was going to happen with COVID. And we said, we could take a hit on our revenue, we could take this, and so we kept that, and we actually lowered expenses, and it enabled us to significantly increase our reserve levels. And you can see it. It's right there. We've drawn it down some, but that was it. And so it wasn't necessarily planned. It was preparing for the worst, hoping for the best, and we kind of lived hoping for the best. Actually, more people came here. We saw our sales tax climb, but we didn't know what was going to happen at that time. So it put us in a position where we didn't spend the money. Okay, we held our expenses low. We even cut expenses, but it gave us a period to where we now have healthier reserves. So we're talking about a policy of what do we do going forward. So it's a great time to do it, but that really tells the story of how we got there, and it really occurred within that 1 year period, 2 year period.
Yeah, and to your point, and I remember that discussion, cutting costs dramatically, keeping the millage where it was so that we could have the reserves for the unknown.
Correct.
And that was for the 2021 budget, I think 2021 budget.
Correct.
And there was rationale for that.
Correct.
So that's why, since then, we've had different discussions about getting it back more to normal. And I think that's why we're having the discussion today.
That's exactly right.
So the other question on the line of credit piece that you talked about, do we have policies that are in place for intergovernment lending between our accounts so that we have access to reserves from other accounts if we needed to on a temporary basis?
There is a policy on, it is available in our policies, and it is very structurally governed. It has to go through a very serious set of circumstances, but yes, for instance, solid waste, right. Solid waste could loan another one of our funds some money, and we would pay it back over time, but it is very structured.
So if something happened and solid waste, the facility there was standing fine,
Yep.
the funds that are there that could be made available for emergencies to be reimbursed at a later. Yeah, I'm just thinking in terms of having that shock absorber in our system.
Yes.
Without having to have something in place that, anyway, just.
It's a fair point, because you've got a reserve fund there that really covers the closeout, the complete closeout of the facility, and post-closure and all that. So you have to keep a very healthy fund balance there. So if you were to draw on that for a period of time, you could do that. And it's an easy way to do it.
Yeah, and again, not being critical about that, I'm just saying the ability to do that in emergencies is important to have at the table.
Commissioner Scott, you had a question?
I do. Thank you, Madam Chair. So in that scenario, Could an enterprise fund only loan money to another enterprise fund? Or could it
No.
loan money to a general fund? I mean, is it?
You could loan it to the general fund, you got to pay it back with interest, and like I said, there's a structured policy on how that would occur. So you got to fully fund up. They can't use their funds for a different purpose, but there's nothing to loan.
And it can lend from one enterprise fund to another. I don't think there's any restriction on that.
There is not. So you can loan from
But you have to
basically-
pay just like you were a customer with a
Yeah.
bank. Right? And for example, the solid waste at the end of the fiscal year had 287 million in fund balance to it. So, I mean, there is that potential there.
And remember, there are significant restrictions on enterprise funds that are not on other ones, specifically solid waste, for closing the landfill. Were everything to stop, they have to have enough money to close that landfill, amongst other things.
So they have to plan for that money to be paid back in time for them to do that, you know?
It's interesting to have that discussion about what the policy looks like for those different funds and what the interest rate would be and how, how long you have to pay it back and all of that.
And we have internally borrowed before.
We have.
I mean, this is not new to us.
You did on the penny.
Yes.
Yeah.
Okay. Thanks.
So here is the recommendation that we are putting before you today, which is to go to 2.5 months, 75 days, or 20.8%, which is significantly up from the 15% that exists today. It is a half a month more than what GFOA is recommending, and that is because we are in a coastal county that has hazards. And by the way, I'm just going to go to the next slide and close out and hit discussion. But I've got some examples. It's not just hurricanes, just so we're clear. We have talked about Lee County. I think we all pestered Lee County trying to get that number, and I couldn't get it either. What I do know is that they have $1.1 billion coming from FEMA over a number of years. That doesn't mean they're floating $1.1 billion. It just means that's what's going to come. So that's out there. But, I was born and raised in Miami. Miami-Dade, after Hurricane Andrew, it took a hit the second year because that's when the homes and the properties were valued at the lower rate. The first year kind of went through. The second year is when they hit their budgetary issues. And it was a real concern back then. Bounced back over a couple of years, but it's not a one-year thing. I'll also suggest, we can talk dot-com busts and great recessions and all those things, pandemics if we want, but some of you may recall back in the 90s the unfortunate incident of a German tourist family right outside of Monticello that they were shot, and it tanked the entire tourism industry in the state of Florida for a couple of years. So I don't want you to think it's just hurricanes out there. There are plenty of other shocks and stresses that we want to keep this aside for. So that's the last of my stuff.
But with the recommendation, it's kind of trying to find a middle ground. I mean, it's probably on the a little bit higher end than what we're seeing in some of our peers, but it's certainly not an anomaly. That would be the same as Sarasota, the same as Hillsborough, and a half of a month more than a couple others. But that's really kind of just starting this conversation. We're not crying foul. I think what you're going to find in Lee County, for instance, the state did a very good job of getting money to them pretty quick, but that hasn't always occurred. So it's measuring the risk. And so we're just trying to look at that and give that to you. You can discuss it. We don't have to set it today. Answer any questions, and we can continue this conversation. But we're just putting it out there for your discussion and for your guidance in terms of where do you want to go.
Commissioner Flowers? Thank you.
Thank you, Madam Chair. Thank you for the presentation and the breakdown of the costs and where they come from. I agree wholeheartedly, Mr. Rose. It doesn't have to be a hurricane or a tornado. In South Florida now, they're just experiencing a normal rain event that has literally on some days shut down the airport. And so we have such traffic that's now moving through Pye that if we were to have anything like that, that would severely compromise that facility. I am concerned, though, I understand why we do it, but I am concerned about taking money or borrowing money from one of the enterprise funds, especially anything related to stormwater or sewer, because those in a storm or hurricane event, those completely go offline, and are one of the things that we want to try to bring back online because of sanitary issues and other health concerns. Certainly, all of the flooding, any backup of waste into the streets and things of that nature are a health concern to the entire county. When you look at, even if you want to go back to Andrew, there are parts of Homestead that are still not rebuilt. When you go down through that area heading to Key West, it's still just green land vacant. Mexico City up in the Panhandle, in some areas still look like that hurricane just hit them not too long ago. And then speaking with some of the other commissioners who live in the Fort Lauderdale, Fort Myers area, when I'm meeting with different county officials and talking about that, there's still some very serious concerns. People who had just purchased homes having to now make other arrangements. So I'm just really concerned when we start talking about borrowing money from other funds versus having that cushion that we need. I do agree. Commissioner Dave Eggers made a comment once before that we would never have enough money to completely bring the county back online. I do agree with that. But we need to have enough money to bring the essential services back online and get some semblance of order while we're trying to put together pieces of funding from other entities. So I do appreciate the presentation, but I just would like to share that when we're talking about any type of reduction in the reserve levels. Thank you.
Thank you, Commissioner Flowers. Mr. Rose, you had another point to make.
There was, forgive me, one last thing, and I had it 3 times in my notes and forgot to say it still. Spending of reserves is a one-time event. It is not a recurring event. So you don't want to get your recurring expenses to get ahead of your recurring revenues. And I meant to say it, I forgot, so I want to make sure I get that out there today. Thank you, Madam Chair.
Say it again, clarification.
Spending of reserves is a one-time event. It is not a recurring revenue source.
That's a good point, because I was going to ask that question when we touched on it a few minutes ago.
You said bring the reserve level down to 15% or 18%. We wouldn't recommend that you put that as a base in your budget because you can only add it once, and if you spend it, you don't have a reoccurring amount the following year. So it should go for one-time expenses if you wanted to bring that down.
Very good point. Commissioner Scott.
Thank you, Madam Chair. I think it would be good to know what our internal borrowing capacity is, and then I think it would be a really good idea, as you suggested, Ken, to look at exploring some external immediate borrowing capacity, whether it be line of credits or what it is. So at least we know, and that internal borrowing capacity is going to change. It's going to be a constantly moving number, but at least we know we've got X amount of reserves, we've got internal borrowing capacity of X, we've got external borrowing capacity of Y. So we know what if we needed it, what we immediately would have available.
Commissioner Justice.
Thank you, Madam Chair. Beyond, and I support a very healthy reserve, but beyond the emergency expenditures that we were talking about, how many times and how much money have we dipped into the reserves in the last 5-7 years for non-emergency expenditures?
Well, you saw that chart where it come down a little bit over the last couple of years. We've been able to do things like the sheriff's helicopter, large replacement. We were able to do some IT items, and so we kind of measure it, and whether and knowing that we've got a healthy reserve, we've been able to use those to capitalize on some big ticket items. That's the reason that number's come down, and it was a good way of doing it because it truly was a one-time purchase.
And I think that's important to remember is that there are things beyond emergencies that come up that are unforeseen or change. Well, the sheriff changed his policy on body cameras, and that was a $4 million mid-year expenditure, and it rolled into several years. So, I mean, there's things that come up that are not emergency that having that reserve gives us the option to change policy without having to cut something else.
That's a good point. Thank you. Commissioner Eggers.
Yeah, I think some of the topics have been touched on. So we're looking at the reserve level, and I'm just trying to make sure I'm clear, just because I don't want things moving around on me with my lack of understanding sometimes. But you've talked about a 21% reserve level, and we've talked about, well, we actually have 25% reserve level. So when we talk about the 16 or 20, whatever you're
20.8.
recommending, is that compared to our 21% right now that we have, or to the 25%? And I don't know what the differences in monies are, but we don't have 21% reserve, right? We have 25%. And so I'm just trying to make sure I understand the differences.
No, you're speaking my language, Commissioner. I appreciate it. And I should also point out the clerk is looking at really point in time, September 30th, last day of the fiscal year. That's what the ACFR, formerly called a CAFR, measures and shows. Ours is a going forward event. It's a current year budgeted number where we're expecting, we're setting it aside. And we do set aside things for Sheriff's Helicopter, and one time we put those aside as well. So in answer to your question, we're looking at it as a difference between 20.1% and 20.8%, which is about $2 million. That's that difference. Now, the 15% would be a much higher number in the $30-ish million range. Okay, but we are recommending we come up off that 15%.
Okay, all right. Well, that was as clear as mud for me, so I'll have to maybe talk to you one-on-one, because I don't want to take a lot of time doing this. But to me, what you talked about where we're at, you're saying that that's where we are at the end of
Yes.
That's where we're at the end of September? That's where we
Yes.
were of last year?
Yes.
And you're saying we've already spent down 5%, or we're spending down 5% of our reserve? You're forecasting at the end of the current budget year being at 21%?
Correct. 21.1.
So we're going to be using 4 or 5% of that, of reserve money
Yes.
this year
Yes.
on different items? Okay.
That's correct.
And I'd like to see what that list is.
Will do.
Thank you.
Commissioner Lappala?
Never mind, I just got my answer, or my question answered, because I was along the same lines. I was trying to figure out if we were talking about the 21 or the 25%, and if that would make the 25% higher.
And we'll
in
bring back,
Commissioner Eggers's example.
we'll bring back to you specifically the list at where you can see what we're talking about, and why we believe that it's at the 21% versus the 25. So we'll account for that from the September 3rd, it's that last year of September to today.
Okay.
And we have some outstanding items on one-time purchases too. I mean, sheriff's driving range. He's going to design it. It's going to come due next year. He tried to get a grant twice and it was vetoed. So, as sure as I'm sitting here, he's going to be coming back for money on that. Those are great projects where, we can look at where we're at. We can look at our expenditure levels and try to plan for some of those, because they're truly one-time events.
And Commissioner Eggers, yeah, the figures that I was presenting, or the snapshot as a fiscal year end, which we know are solid figures, and obviously, we're now into April, which a lot of months in between there, so the situation has changed. But as of that time, there was 188 million, which represented 25%.
Yeah.
Okay.
Yep. Thank you. And through the chair, okay. So we want to get a regular way of talking about this with you. That is absolute my intent. And so I would love to sit with you, and then we start talking the same way every time after that.
All right.
That was a really good presentation, and I hope you don't mind the questions. And it's a complicated thing to learn, and you have to say it more than once to really get it stuck in there. So thank you.
Just one final comment.
Only one?
Yeah, one, I promise.
Uh-huh.
So when we get down to that magical number of 16.7% or 20 point, whatever we decide to be at, and we're going to do our budget for the following year, we're going to be budgeting for expected capital expenses that we should be anticipating and putting in the process. There may come something during the year that is unexpected, that drops us below that level, that we have to work back up to that level. There's nothing wrong with having to do that part of the process. That's why you have a reserve. Sometimes we get into these discussions, and I say, well, we give no credit to the first 15%. They're just sitting there doing nothing except giving us comfort and about risk relief. But they are part of that fluctuating and shock absorber to the system, that we don't have to just budget 5% over just in case something comes up. We need to be thinking ahead, budgeting the corresponding amount, and if we go under it during the year, we'll have to, in the new budget, we'll have to figure out a way to get it back up to that number. And it's not as easy, but that's what we're all paid for, to do the hard work sometimes. So thank you.
Good point. Anyone else? Barry?
All right, next topic, the man of many hats, Brian Loeck's going to come up, and he's going to talk to you about the Charter Review Commission and the
Morning,
process that we are recommending we use going forward this year.
Good morning, Commissioners. I've got good news for you. First, this is going to be quick, and second, I'm not talking percentages. So, want to give a quick 5-minute high-level overview on the Charter Review Commission. We are there at that point in time where that is about to be reconstituted, and want to make sure that you're aware of what to expect as we move forward. So a little brief history. In 1968, Florida voters amended the state constitution to allow counties, to give counties the power to govern themselves. This is what we often refer to as home rule. 20 of the 67 counties in the state are charter counties, and Pinellas County became a charter county in 1980 when voters approved that at referendum. Pinellas County Charter Review Commission meets every 8 years, and they review the charter and make recommendations to amend the charter. Composition of the Charter Review Commission: 13 members, all appointed by the Board of County Commissioners, 1 county commissioner, 1 constitutional officer, 1 member of the legislative delegation who resides in Pinellas County, 1 municipal elected official, and then there are 9 members of the public, these 7 of which are nominated from individual county commission districts. They must reside in each of those districts, and they cannot be an elected official. 2 of the members of the public are from, they can live anywhere as long as it's in Pinellas County.
Question.
Commissioner Justice.
Just a quick question on this point. Is this makeup, the composition of the commission, is that set by our charter? Is that set by state law? Where is this defined?
The makeup of the Charter Review Commission is defined in your charter. And actually, the 7 members and the 9 members from the public, this is the first time. That was an amendment that came out of the last review. It used to just be 9 members of the public. Now it's 7 and 2.
Thank you.
Question as well. Just
Commissioner Eggers.
confirmation on the 7 members that reside in the district. So it's not necessarily in the at-large folks, the 4 at-large. It's not just in the area where they live. It could be anybody in the county in those cases.
Sure. So the 4 that come from the single-member districts?
I meant the 3 at-large. I apologize.
Correct. The 4 from the at-large must live in that same commissioner's at-large district, or excuse me, single-member district. And the 3 from the at-large districts, those commissioners can, as long as the nomination resides in Pinellas County, it's good.
Right. It's not just in the area that they reside in.
Correct.
Gotcha.
For the 3. For the 3, not
Yes, for the 3, yeah. That's actually for, yeah, also, yeah.
As far as the timeline requirements that are established in your charter, no later than August 1st of this year, the board must make those appointments. No later than August 18th of this year, the CRC must hold its first meeting. That's an organizational meeting. July 31st of next year is when the CRC is required to provide a report, including any charter amendments, to the citizens of Pinellas County. No later than September 21st of next year, publication of referendum questions would be required if there are any, and any of those amendments would be on next year's general election, November 5th. So as far as a proposed schedule moving forward following this meeting, likely early next week, we'll have everything ready to advertise and open up the CRC application period. May 31st, application cycle will be closed. And then by June, we will make a selection of a CRC facilitator. The county attorney's office will also be selecting a outside counsel to work with the commission. And then July 18th of this year is when we will bring the CRC appointments to the board at your BCC meeting for approval.
Brian, I think there's a correction in what you just said. The county attorney's office does not select the counsel. I think the Charter Review Commission itself picks the counsel for the Charter Review Commission.
I defer to the county attorney's office.
I'll have to take a look at that. I believe in the past we've recommended counsel to them, but yeah, that's probably correct.
Last time we went through an RFP process, we got Wade Voss from Orange County.
That was RFP?
Yeah, it was through and same with the
Mr. Burke and
facilitator.
I served on that charter review, so I remember that as well.
Okay. Well, your recollection is better than mine, but I'll certainly loop back and confirm all of that and double check.
I
And if there's,
questioned that yesterday when Brian spoke to me, and I didn't want to challenge him in the moment, but I was counting on you to set us straight. Thank you.
okay, question.
Yeah.
The importance of the Charter Review Commission for us is, I've always told folks that there are 3 ways to change the charter. One, petition-led process by residents, which is arduous and painful, but still it's a process that can happen. The county commission can institute ideas and policies and changes for referendum. I think it takes a supermajority of us, just a question mark. And the third one is this process. So the Charter Review Commission will come up with their recommendations and language. Does it still require commission approval, or is it kind of more like a rubber stamp approval because we're trying to make it 3 different ways to get a charter changed, or how is that piece?
Just to clarify that, the charter, any recommended amendments that come from the CRC, those go to referendum as long as they're contained as recommendations in their final report. The Board of County Commissioners, it states in the charter, shall call a referendum for those to be placed on the ballot. But as far as those coming to you and you approving which ones or if any of them go, no, that's not how it works. CRC sends them right.
Yeah, that's what I kept telling people. I have 3 independent ways to do it, and just wanted to make sure I was clear on that. So, thank you.
Anybody else on this issue?
I do have one other question.
Of course
Of course I do.
Go ahead.
Just one question. What happens just by, happenstance that the county commission independently, because it kind of comes together at some point in time, the cutoff date of what goes on the ballot, doesn't hear or see things happening in that CRC that is to their liking and takes up a different item, or it could end up being both be moving forward. Can you have same item being moved forward separately?
Yeah, so I think to answer that question is in that report, which is due to the citizens, and you all will receive a copy of that. Prior to presenting that report, any proposed amendments must have a minimum. They must have 2 public hearings from the CRC. And looking at my notes, I believe
Around the middle of June or something, I think.
it would be June when those public hearings will be held. So you will know if things are on there or not on there in June.
Because between that and the actual final date, they can't add any additional ones.
No, because it has to
Right,
work
'cause
with
the
the
public hearings,
supervisor of
yeah.
elections and the
But-
public hearings. Yes, Commissioner Justice.
Just since Commissioner Eggers brought up the topic now, made me curious. If you did have competing charter amendments, one by the Review Commission and one by the Commission, in the legislature, it's whatever passes last is the one that takes precedent. But I wouldn't know, that it's a good attorney research project. If you had 2 competing things, one that says the county shall, paint the skyway blue, and the one that says it's going to paint it green, which one takes precedent? It's an interesting question. Since Commissioner Eggers is already worried about what the Charter Commission is going to do.
No, not at all. I just wanted to make sure this.
the appointments yet.
I just want to make sure that they consider things that we would all consider as well. Thank you.
Okay, Brian,
Thank you, Commissioner.
you're welcome. Thank you. All right, before we move forward, Barry, with everyone's consensus, I'd like to take a 5-minute break so that we can make sure we're all back here and paying attention. Thank you. back to order, please. We're going to have a presentation on the small business enterprise update. Barry?
All right, so Corey's on his way up. And again, we haven't given you an update on our small business enterprise program. So Corey is responsible for that
Morning,
division.
Corey.
And
Good morning. How's
Here he is.
everyone? I promise you I won't talk about reserve funds at all. No. Just want to give a brief overview of the program and talk about some key initiatives that we have, as well as our work plan that we have for the program. 4 years ago, the small business program was repositioned to be more visible in the community. The intent of this effort was to establish a race and gender neutral program that would attract more small businesses who have the capabilities and the capacity to provide products and services throughout the county. Since the revision of the program, the number of participants has steadily increased. Some small businesses can be seen providing services and delivering on products throughout the county. The success of the program is often associated with construction, as you can see the pictures there, because the actual construction projects are visible and they give a chance for small businesses to do a multitude of things and perform in different capacities. Many of the small businesses that work in the program were subcontractors on, like you see here, on the actual county courthouse building. They participated in that, as well as some of these small businesses were prime contractors. They were individuals who actually helped construct some of the miles of new sidewalks, and also did the boardwalks and some of the piers around the county, fishing piers around the county. However, the opportunity with the county extends beyond construction activities. Small businesses also compete for goods and services contracts. They've won a variety of them and supply the county with water valves, HVAC filters, traffic light poles, paints, and services related to healthcare, construction design, and much, much more. The possibility for increased involvement of small businesses in the county annual goods and services spend is extremely promising. As I traveled around the county to meet some of the directors in the various departments, they were excited to hear about the capacity and the capabilities of small businesses, and expressed a great interest in having buyers from their department meet with some of the small businesses in the future to talk about how those small businesses can provide services and goods to their department. As you can see here on this particular chart, as I mentioned earlier, the relationship between the county and the small business community has grown. As of fiscal year 22, the average annual award to small businesses grew to $21,570,000, while payments averaged $15,545,000 per year. As seen from this slide, awards generally outpace payments annually. Awards for projects or purchases approved in 1 year may not require payment until the following year. For example, in fiscal year 22, $28,370,000 in awards were authorized within a year. But a significant portion of the awards were for construction projects that were slated to start in fiscal year 2023. Payments are made when work is completed, and payment for projects will be captured for these particular projects at year-end reporting. As you can see from this slide here, from fiscal year 19 to date, the county has been awarded local small businesses a total of $143 million. Over that same period, payments equal $113 million. It is shown communities benefit when small businesses can do business with local government in this fashion, as small businesses tend to recycle more revenue back into the community, create the majority of all new jobs, and they employ more than half of the workforce and retain more employees during economic downturn than larger corporations. Given this type of return on investment, The Office of Small Business continues to work with the community and other agencies to share resources to strengthen the small businesses, strengthen the pool of small businesses who are ready, willing, and able to provide the products and services the county needs. As you can see from this slide here, these are some of the key projects that we're working on to enhance our engagement of small businesses around the county. One of the things that we found is that the county does a lot of business online with Amazon as well as Granger. What we want to do is increase the number of small businesses who are registered on these platforms and highlight them so that the buyers around the county have an opportunity to engage with these small businesses in another avenue just to be able to do business with the county.
Yeah, and Commissioners, it's important to know under the sheltered program that we're talking about, we still require them to sharpen their pencil. Okay, we're not required to do that. So we want to engage a small business, but we want to do it at a competitive price. So it gives us flexibility in trying to push more of those contracts local, but not at the expense of much higher cost. And that's an important component piece. And that's the reason you got to balance it with, you know, the cost versus trying to keep those jobs local.
And that's, you know, leading to my next point when we talk about the Think SBE campaign. We really just want to, with that campaign, we're asking, as we go around the county and talk to some of the directors, we're just asking that those directors, as they do their normal course of business, to just think about an SBE and consider them. We encourage departments to consider small businesses in all forms of procurement. Whether it's a $150,000 market solicitation or if it's just a P-card purchase. We really want and encourage departments to include SBEs in their consideration. The other thing that we're working on in terms of initiative is we're doing a survey. We want to survey some of the participants of the program to get feedback on their experience with the program and how they actually understand the bid process for the county, just to get some basic information so that we can formulate different processes and be able to move forward in a more efficient manner. The last thing I have here for you is our work plan. We want to create an electronic vendor match system. This will allow us to analyze department vendors' needs and help shape our actual target recruitment. So when we go out and talk to small businesses, if we know what the department wants and needs are in terms of vendors, we're going to go out and recruit those businesses that can match the needs of those departments. And I think that's critical. And being able to do that on an electronic platform and to make it real easy for us to track is the goal with that. The other thing, as I had there, I said before, Think SBE, and that's one of the things that we want to push over and over again because the more that we have the opportunity, especially in the areas of goods and services, to remind departments around the county just to think about SBEs and try to utilize them as much as you can, we're going to see continued growth of the program. The other thing, as I had said before, we talked about Granger and Amazon. We want to continue to put small businesses on those platforms so that buyers around the county can see those individual businesses and be able to engage with them. Then the other thing that I have here is we want to also increase the goods and services spend with SBEs around the county, really promote that as well. And then the last thing I have is to continue to diversify the supply chain by increasing program participation for underrepresented vendors, women, ethnic minorities, and veterans. And I'll take any questions that you have.
Questions from the commissioners? Anybody? No? Wow. Oh, of course, Commissioner Eggers. Just 2 quick ones. Okay.
So explaining the difference between what's being paid and what's being authorized is more multi-year construction projects? Is that
correct? So what happens is that you have an award or a purchase that might be made in fiscal, let's say fiscal year 22, but the actual start of those projects doesn't happen until the next fiscal year. And so it's going to be a lag between what the award is and then when the actual work is done and then the resulting payment.
okay? And I don't think we've ever set up a policy that favors contractors within Pinellas County versus a contractor outside Pinellas County in terms of rating the two. Is that the same? So if we do that and an outside contractor uses SBEs, because we're still going to judge their contract bid on whether they hit so many, the percentage of their contract being covered by SBEs, are we requiring those SBEs in Pinellas County, or are they just small businesses anywhere? Is there any policy?
We have a defined geographical location for the program, which is the immediate Bay Area. So those businesses would have to be in Pinellas, Pasco, Manatee, and Hillsborough County. So they would have to come from those 4 counties.
Okay.
And they do this under a centralized database that is,
Correct.
the other counties mirror also.
That would be-
They, you know, if you're in Tarpon, you don't really care whether you're working in Pasco or here, right? And
No, that makes sense. I just didn't know, I want to make sure we were doing the same thing in our SBE program that we're doing on the contractors. Not
Correct.
just limiting it to Pinellas County.
Correct.
Not that that's a bad thing to have Pinellas County contractors, but, you know, we want to get the best use of our tax dollars. And so
correct.
competitive
we don't,
bids
we
come
don't
from-
have a set aside, so it's not, you know, we do measure, okay? And then we report those, you see that on your contracts, you say that 10% or 8% or whatever, you know, and the picture that Corey started out with at our CJC project, that project with creative contractors, they got 48% SBE. So they had a lot of local companies working on our project by us measuring. They did it, you know, and creative contractors did a great job on that. And, you know, and you're going to go to the ribbon cutting tomorrow. But again, 48% FDE or SBE, and that's a $60 million project. So very good stuff.
Great stuff.
That was it?
That's it.
You sure?
I'm done. I think.
Okay. Anyone else while we're on this subject? No one? Very good. Thank you so much for that great presentation.
Thank you.
And now we have our towing ordinance review.
And Doug, you're on.
Doug?
Good morning, Commissioners. Doug
Morning.
Templeton, Chief Investigator with Consumer Protection. The Office of Consumer Protection oversees several county ordinances, one of which is the towing ordinance. We last met 3 years ago, and at that time, we made a commitment to conduct a review every 3 years, so we're kicking off that process today. Information I'm going to review today aligns with the memo that was sent to you on April 7th by Assistant County Administrator Lourdes Benedict. So in 2016, we brought forth several updates to the towing ordinance to provide some additional consumer protections. And in 2019, we sought feedback from the towing industry and brought forward fee adjustments. And we said at that time we'd continue to review the ordinance every 3 years to ensure it stays current with the marketplace. We've met with tow industry representatives as well as individual tow company operators to obtain feedback and input. We also sought feedback from our law enforcement partners, and they didn't express any current concerns at this time. So based on the feedback, the industry has expressed several challenges that they've experienced with the economy and additional costs, including vehicle increase, fuel price increases, insurance increases, staffing concerns, and maintaining a competitive marketplace here in Pinellas County. So as part of our review, there are several language updates and recommendations we're requesting to ensure consumer protections and assist with compliance. Consumer protection contact information as part of the county's rebranding utilizing Pinellas.gov. We're simply updating our contact information. This is required on receipts as well as at tow locations on their signage. Language within the ordinance is being updated to align with definitions that already exist there within the ordinance. There are 2 different types of tows that fall under the ordinance. You have a trespass tow, that's your tow at an apartment complex or a business where someone's illegally parked, and then non-consensual tows, which are police directed, whether the individual is incapacitated or the vehicle is in an accident. So those definitions were previously updated to specify private property trespass tow and police-directed non-consensual tow, and we're updating language just to align with those throughout. There are also several updates we recommend to assist with compliance efforts. Start and end dates for written agreements. The ordinance requires a written agreement between the tow operator and the property owner. We're recommending start and end dates be added to these agreements along with language which defines the terms and renewal process for these agreements. Maintenance of tow records. Ordinance requires tow operators to make records available during normal business hours to consumer protection or law enforcement. If there's been a need to visit during a compliance check, we've had some instances of those records actually being kept at other locations or even out of county. If those can be provided electronically, then that's acceptable, and we will take those, but otherwise, sometimes these records have been off-site, so we're requesting that they be required to maintain them on-site. Towing of large or hitched vehicles, we're just clarifying that no additional fees for motor vehicles towing boats, cars, or heavy equipment. If it's securely attached, it's all considered part of one vehicle load and is considered one tow, so they can split that into two separate fees. Credit card merchant fees, there was a concern from tow operators that they brought to us. We recommend we update the language to allow for tow operators to pass along the actual fees that they are charged from their merchant companies. Currently, there's a flat 3% fee that's allowed, so we want them to be able to pass along that actual fee, whether it's 2.5 or if it's 3.5, with a ceiling of 4%. Written response to complaints. As I mentioned, businesses are required to provide us records during normal business hours. However, to avoid interrupting business operations, when we receive a complaint, we send them a letter with a copy of the complaint. We request a written response within 7 days. We do at times have challenges in obtaining a response. And so this, I believe, helps us as well as tow operators. They can respond at their convenience, and we limit interruptions to their business operations by not having to visit their location. So as part of our process, we've also reviewed other jurisdictions' fee schedules. They've made updates as well. We try to stay balanced and in line with some of those other jurisdictions. Based on our review, they have updated some of their fees to adjust for some of the pressures that the industry is feeling as well. So we invited feedback, as I mentioned, from tow operators as well as the Professional Records of Florida organization statewide. The association provided recommendations that keep us in alignment with other jurisdictions and that balance consumer needs while trying to ensure a competitive marketplace. Their initial version included the addition of a dolly fee, but currently our ordinance doesn't allow for any special fees or special equipment or services, so that's not incorporated into those fees. But as you can see with these recommendations, most of those standard fees would increase by anywhere from 17 to 20%. So with the current pressures, there is a need for an adjustment to allow for the industry to continue to be a healthy marketplace, and this is what we've received as a recommendation. Based on input from the industry, we are recommending adjustments to maintain a competitive marketplace while balancing those consumer protections. Just for perspective, typical trespass tow, that is what 95% of what we see in complaints would entail a base tow fee and then potentially mileage. Because of the county's size, they're limited to 10 miles of towing distance. So with these adjustments, the average towing fee would increase by approximately 19% is what would be the effect of that. As I mentioned, we do propose to continue conducting this review every 3 years. Any questions?
Thank you very much. Are there any questions from the members? Commissioner Justice.
Thank you. You said 95% are so someone's parked where they're not supposed to be parked, and they, I like to say it's never happened to me, but when would there be a time when there's no storage? Because I thought once it got pulled into the lot, it's stored and you're charged that storage.
After the first 6 hours. So, yeah, if you're able to respond and pick up your car within that first 6 hours, then they wouldn't charge it. But after that, they're able to accumulate a daily rate beyond that after those first 6.
Okay. And then this is kind of separate from what you're talking about on the review, but have we had any complaints, calls, issues on our banning the towing of cars from establishments that serve alcohol after then that overnight time period?
Sure.
Since you're here.
We've had a few. We have had several. I mean, hopefully that means it's working. But, just for background, that there was a measure in 2016 passed that aimed to reduce the incentive to drive under the influence. So it prohibits vehicles being towed from property where they're licensed to sell alcohol between the hours of 9 p.m. and noon the following day. They are able to tow still, but it requires a signature by the property owner in order to do that. So that was kind of the thought behind that process. And The few we've had, it's been an education and compliance effort. They refunded the money and have addressed the issue.
Very good. Thank you.
Yes, sir.
Commissioner Flowers, the chair indicated that you were called on.
Thank you. I didn't hear her. So my question is, I wasn't able to hear you very well. Did you say that you were not incorporating the request for the increase in fees as it relates to credit card charges?
Currently there's a 3% fee that they can charge if an individual utilizes credit or debit card. They even explained that there are fees that are actually above the 3% that some of them experienced. Their merchant companies charge more than that. So we're simply requesting to update the language to allow the actual fee they're charged to be passed along to the consumer with a ceiling of 4%. Most of those, I think they indicated around 3 to 3.5% is what they're charged.
Okay, all right. Thank you.
Yes, ma'am.
And Commissioners, anyone else that's here?
Got it.
Commissioner Scott?
Thank you, Madam Chair. Did you say reviewing the rates every 2 years or 3 years? I didn't catch that.
Every 3 years is what we, had originally done. The last time the fees were updated in December of 19, we indicated we'd come back 3 years after that, and then we're proposing to continue to do that.
Okay, all right, thank you.
Yes, sir.
Barry? Oh, hold on. Commissioner Edwards?
Yeah, on the, these are the recommendations. These are the recommendations that have been made based, I'm assuming, based on comparisons, right, to other counties?
Yes, several of the counties, these fees were provided by Professional Records of Florida. They base their fees on, the CPI, I believe from 19 to 22 has increased significantly. And a lot of the other local jurisdictions, that memo that was sent out did have a comparison. Just for instance, that base tow fee, Class A vehicle in Pasco is currently at $150. And Hillsborough is currently going through a review process with their fees, and they have not passed that yet. My understanding is the increased rates resolution would be included on their next BCC agenda for approval. They are looking to go to $160 for their base tow fee.
Yeah, thanks for reminding me that we had that information. I didn't have that right in front of me. Okay, so that's the most important thing to me, is that we are somewhat competitive in the area. So regardless of whether it's a CPI increase and that gets us to this point, yeah, we don't want people taking their business elsewhere, so to speak. So thank you.
Anyone else? Okay, Barry, you have a question?
Actually, it's more of a statement from Commissioner Peters. And her question originally that I think, Doug, you answered really has to do with this technology changes, that we have a process to keep up with those changes. The way in which they tow vehicles, versus follies or flatbeds or other different things, that we just keep an eye on that and we make changes accordingly. I think that's what she wanted me to say.
Okay, anybody else? No? All right, thank you. And now we are on our commission agenda for Tuesday.
All right, Commissioners, if you'll go to your agenda, we've got the various administrative items up until item number 12. 10. Item number 10 is a joint funding agreement with U.S. Geological Survey. They do this data gathering. This allows us to look at flood stages, discharges, rainfall, et cetera, and stuff, and we use this with all of our departments. This contract will have a county contribution of $228,000, and USGS is contributing $71,000 for a total of a $300,000 contract. Item number 11 is award of bid to United Scrap Metal for the sale of scrap metal. And this is out of the solid waste department. So this is prior to it going into the waste energy facility. This is what we pull out before it goes there, washers and whatever. Item 12 is an award of a contract to Brentag Midwest and Hawkins, and this is for liquid ammonium sulfate. This is through a Tampa Bay area cooperative contract with several different entities, and so both utilities and solid waste use this contract. $273,000. Item 13 is a ratification of an emergency agreement with 3B Cattle for land management at Crossbar Albar Ranch. And this is to bridge the time in which they go out and bid for services.
So, Barry, is that going out to bid now?
Yes, it is already out to bid. Yeah. This was to bridge until they can get that competitive bid out.
Okay, thank you.
Item 15 is award of bid to Superior Mechanical. This is for Star Handler, for the Star Center, air handlers 1, 3, and 9. And this comes out of the Star Center budget, $654,000. We got some receipt and file items. And then item 18, this is termination of an agreement with commercial landscape professionals for landscape and irrigation. Let's see. This is for cause and continued failure within the contract. And we have another contract already in place on that, or is that coming? It's coming? Okay. Joe, do you know, is there a lapse in service? How is that being covered? Okay. Item 19 is an agreement with Inner Circle Sports, and this is continued consulting services for the Rays. And we split this with the city of St. Petersburg. There will be a follow-on contract if things progress. That'll be different. That'll get far more detailed.
Can't we say when things progress?
However it occurs.
I like the positive.
Item 20 is state-funded grant agreement. This is with Florida Department of Transportation. This is for our ATMS system on Route 580 from Alt 19 to Maine. $338,000. I'm sorry, $338,000 in state funds, county match of $1.7 million. Item 21, similar. This is for State Road 586, which is the Causeway Boulevard Curlew from Honeymoon Park to US 19. Item 22 is an increase in the upset limit for Frontier Communications for 2 Ethernet service locations. This is to connect between Clearwater and St. Pete. These are our 2 secondary PSAPs. Item 23 is first amendment to rate peers for professional engineering services associated with the Gulf Beach Water Booster Station improvement. And under County Commission, we will be asking to approve a resolution for a joint meeting with Pasco and Hillsborough County. On the public hearings, item 27 is petition for a 10-foot drainage easement. County staff has no objection to the vacation. Item 28 is a proposed resolution expanding the boundaries of the existing City of Largo Clearwater Road CRA and making a finding of necessity that blighted conditions exist. This is a request coming to you, and the areas are outlined within your packet. That's it.
So back to the comment you made about our joint meeting.
Yes.
At what point do you think we might get an agenda for that?
As soon as I confirm that with the others, I sent it to them yesterday, and then I'm going to be briefing you on our one-on-ones based upon all your feedback, and then we will then publish that.
Perfect.
Okay, so next week I'll be reviewing that agenda with you.
Thank you.
And on the access to that meeting, understand. I was thinking that the conference room was really big, and apparently it's not really big. It's smaller than big.
Yeah.
So how are we?
I haven't been there, but
How are we?
Della's
how are
on her
we
way.
Accommodating,
Which conference room are you talking
the one
about?
at the airport,
Yeah.
I thought it was-
International Airport.
You've been there?
I've been in there. It's
Della?
fairly large.
They're doing a site visit next Thursday, and I'm not sure where they're doing it. It'll be a public meeting. We're going to handle it similar to how we do with the TDC or how we do with the delegation. So we'll have, it'll be a public meeting and everything, and we'll have access for that for the public. But even the airport, they don't have any audiovisual equipment. They don't televise their meetings or anything like that. So from a logistics standpoint, that just really wasn't feasible. But we can do. We will have areas for the public and under public comment.
So I'm curious, is it at the airport or at
Yes.
the new Tower One?
New Tower 1, correct? Yeah.
Well, that's fabulous because that
Correct.
facility is incredible.
But apparently can't do access for our public that wants to watch the
I'm
meeting.
surprised to hear
Yeah,
that.
that's,
actually.
that's
So
surprising.
high-tech.
Yeah.
They don't have the audiovisual capabilities there. So if we wanted to stand that up differently, because they don't televise their meetings. So,
Do we have the capability of like filming it ourselves or
we could.
anything like that? Even if it's not live, just so we can put it on the YouTube later?
You can. It's a lot of logistics because you've got to have multiple microphones, you've got to have multiple camera angles, and trying to edit that. That's the reason we don't do it for our delegation meeting or for the TDC. We have the meeting, it is public, people can go online, see the minutes and everything. But so is it possible? Absolutely. It's a lot of logistical support, a lot.
So the fact that this is pretty historic and we're doing it for the very first time, I think it's probably wise to move forward like we've already planned. And then maybe when we do the second iteration of it, it could be a little more.
Here. And I would suggest at that meeting, that's something that you could talk about because,
Yeah.
again, different people do things differently, and so there's different views. So we've been kind of caught in the middle, I'll be honest.
Yeah,
on
we had
that.
the
So
same issue with
talk-
T-BARTA.
Yeah, talk to your peers when you're doing that, and that gives us clear direction from staff on how do you want to do this going forward. We'd be happy to do that.
When we would go make our, rounds and go around the region and we would go up to Pasco County, their capability of doing what we do is very antiquated at best. And, well, I didn't know how else to say. Well, okay, but I was trying to be nice. You guys, come on.
We're trying to have
And
a
then
good
when we go-
meeting.
Wait a minute. Then when-
That's not how we do.
Yeah, that's not how we-
That doesn't endear us to regional meetings, guys.
Seriously, and on the brink of me wanting to tell you about the opportunity in London and what they said to us, you ought to be ashamed of yourselves. What are you talking about? That's my point.
right.
Okay.
I'm
All
totally
right, so
confused.
moving on, Dr. Cynthia Johnson is here this morning, and if I might take just a few moments of personal privilege to ask her to come up to the podium, because she was with us on the trip, as was our new Mayor Onks from Clearwater, and Mayor Welch from St. Pete, and Mayor Castor from Tampa. It was a delegation of 16. We were very busy and very boom, 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 boom from our meetings, right, Dr. Johnson?
Absolutely,
We had some
Commissioner.
incredible speakers who gave us lots of knowledge, especially the woman from J.P. Morgan Chase Bank, who had been with them for 32 years and had worked in various departments throughout the banking system. And her comments about blockchain technology and AI, quote unquote, artificial intelligence, were absolutely so profound about the world of technology and how it's moving our whole world forward. And I thought one of the most interesting things that she said was when she said, You have to be prepared to be disrupted, because if you do not, you will be totally disrupted, and you won't be able to continue fitting in with the movement of the world. And I just thought that was so profound. And there were lots of other opportunities that we had that were historic in oh so many ways. But before I ask Dr. Johnson to weigh in, one of the other most intriguing pieces, and this is what I was trying to get to Commissioner Eggers and Commissioner Latvala, we met with the head of Virgin Air, who was the airline that we flew over to London on. And they're a new airline with new service from Tampa to London, nonstop, and going over and coming back. It was a beautiful flight and a beautiful plane, very, very modern in terms of how it was laid out. But he told us that one of the reasons that he chose Tampa International Airport, besides, of course, it's the #1 airport in the whole United States, was the fact that they could see the region working together to accomplish big things, and that they saw the region as evolving and growing, and they knew that if they put their new flights here, that they would grow and prosper as well. And I just thought that was so affirming for the way that we were all working together and getting along, and. So without further ado, you please weigh in.
Good morning, Cynthia Johnson, Economic Development. I just wanted to add a couple of comments. The foreign direct investment mission that we went on was in partnership with Virgin Airlines in the region. I'll just highlight about 4 key things that kind of came out of that opportunity. One, us having the opportunity to have our local elected officials. So we had the chairs of Pinellas, Hillsborough, and Pasco County Commission participate, as well as our regional mayors from St. Pete, Clearwater, and Tampa. And the opportunity for them to have some very isolated engagement time to talk about regional opportunities turned out to be a fabulous result of the mission. I heard lots of comments about, gosh, I didn't know Commissioner that well, or I didn't know the mayor, and just having those collaborations was really good. The other part of the mission that I just wanted to highlight is we will be doing an after-action report to talk about the impact, because we had a 2-track mission. We had our delegates, and then we had staff who were participating in the foreign direct investment component, where we were actually sitting down talking about prospecting opportunities for the Tampa Bay region. And it is turning out to be very fruitful. I have my team working on a very good potential opportunity for us here in Pinellas County as a result of that. The other thing that we found to be very interesting was we had the opportunity to work with the CVB. So before going over, we had talked to Steve, and as you all know, Steve and I have been working very closely together to talk about how can we promote come to play, stay to work kind of theme to really get our visitors to see our community as a destination for great tourism and an awesome destination for an ideal business climate. So in doing that, we were able to experience the marketing efforts that are occurring by the CVB over in London on behalf of Visit St. Pete Clearwater. So in that presentation, the delegation got an opportunity to see how Visit St. Pete Clearwater uses our London delegates to actually promote the community as a destination for tourism and a destination for business. And to see it real time, it was very, very well received. The ads and we saw a bus. I didn't see it, but I was told, hey, that bus has St. Pete Clearwater on it. And so it was really exciting to see in another country us making an impact, bringing people to our communities. And then lastly, a really key part of it was to help the delegation understand what we do in economic development when we do our international missions. So we went to KPMG, which is a site selection company, and they gave us a case study of an actual opportunity where they have just assessed our region and what were they looking for. And they were pretty candid with the conversation of what was our pluses, what was our deltas, what were the opportunities, what did his client find to be very attractive. And this is about 500 jobs. Transparently, they have already made a decision exactly where in the region they want to go, but it was very clear that the region was the attractor, not just the one community. So being able to have access to regional workforce was key. It was definitely a plus for us to have our education system between St. Pete College, Eckerd College, USF, Pinellas Technical College, University of Tampa, and the other institutions that provide training all in the same area. One of the very glaring deltas was our infrastructure and transportation. And, you know, we got on the red list for that area. But what that did do is give us another opportunity to talk about where we have opportunities as a region. So it was a very fruitful trip. I think some old friends met some new friends, and some new opportunities met some existing opportunities. And I look forward to sharing with Commissioner the after action report that we are currently putting together, and hopefully we have some good new opportunities for our citizens with some job opportunities that will come out of that mission.
Very good. And don't forget to add in the part about the Mini Cooper Parade.
We did have a Mini Cooper Parade, and I did get my 6-foot self in a little bitty tiny car. My back still hurt, but it was fun. It was a nice end to a very busy week, and I want to commend Commissioner for allowing me to wake her up at 7 in the morning and keep her out to probably 10 at night at meetings every day we were there, and she was a trooper, so I do appreciate you.
Thank you.
All right.
I appreciate you as well. It was a great trip, all said and done. So any questions, comments, or snarky little?
No, I'm not still sure what you meant by we should be embarrassed about something. So that's what my question was. Thank you for that report. That was great. Sounds really wonderful. And we talked to economists about this area. It kind of reflects a little bit about what they're saying, which is this is a really powerful region.
Yeah. Yep.
Businesses know it, and the schools know it, and as long as the governments are playing better together, and I think that's why it's so important that we're having this meeting next month.
And you know,
maybe we can even be better than we, are doing. So
absolutely. And Commissioner, I just want to add that when you were chair, we implemented a new process that when we actually go on a trade mission where we take companies with us, we do a recap with the companies to talk with the chair and the city representatives of those companies to talk about their experience and their opportunities to support. So we will definitely continue to do that as part of our international business development activities.
So that KPMG report on the pluses and minuses to the region would be fascinating to.
And they did provide it. It is part of our after-action package that we will receive. So it was redacted enough that we can share that with you.
Thank you.
You're welcome.
And just thank you so much, Dr. Johnson.
You're welcome.
Thank you for being here. So as soon as I get that report, you can be assured I will make sure every one of you get a copy of it so that you can read it at your leisure. And good job done by all.
Just one question for Barry.
Yeah.
Barry, back on that joint meeting that we're not going to televise to our residents, and I find it strange that all commissioners can agree on one thing, which is our residents should be able to have access to what we're doing. And since we're leaving the county, it would be even more important. But I do think it's important that we figure that one out, and looking forward to the discussion points that we're going to have. I'm assuming it's 2 hours? that we're
Correct.
gonna- And, so the only other thought I had is making sure that once you do that review of the place, make sure that if they have the technology, of course, in this podunk airport, we know it's the best in the world. We know it's the best in the world, or in this country, that we have plenty of seating areas outside, maybe that can't fit in the room, that people can come and maybe sit somewhere and watch what's going on.
We will definitely have room for anybody that wishes to attend that. And, I can't wait for you all to get together and paint that future picture, because trying to, get 19 individual ideas and stuff is rather difficult. There's, and so, we're trying to put this together. It's a way to facilitate a forum. But a key part of that agenda is future topics, future issues, and the way you want to operate. So we'd be happy to take that type of feedback and set that direction, and so.
So, and to your point, Commissioner Eggers, if I may, remember how this has been an ongoing mission for the last 5 or 6 years that we've been trying to get this meeting together. And you know best of everyone how difficult it can be just by being on the TMA, right? So as Barry told me when I thought I had come up with another fabulous idea, we have to learn to walk before we run. Is that what you said? Something like that.
Probably. I don't, which time?
Yeah.
It's been a challenge, I mean, everybody just does business a little bit different, and that's one of the things we're going to talk about. We've been talking as county administrators, but, everybody has their own thoughts. And so trying to find a way of getting us there, and I think we're here, and we look forward to you telling us how you want to operate in the future, and we'd be happy to accommodate that.
Well, a good way to start is to focus on the things that we can agree on. Like
Absolutely.
we all touch Tampa Bay, and that's a big issue to protect and take care of.
And the good part about it is you have very good stories that you all represent regional bodies right now. There's also a collaboration component. Ever since the pandemic, Bonnie, Dan, and I were getting together throughout that. So as we're talking and you're talking about the direction you want to set, we also heard other ideas and how they took it. It didn't mean that we adopted it. It's a different county. They have their own county commission. They can set that direction. But just hearing other thoughts and ideas probably helped us develop a better policy in some small way. And so there's examples like that. When we were coordinating school departures during the hurricane and closures and things like that, Bonnie and I were on the phone talking about what they're going to do and why. And so I knew, and I had a heads up on some of that decision making that they're doing. And so so we're trying to come together. So there's a lot of that goes on behind the scenes. This will be another way to expand that on all the good work that you already do on a regional basis. So I think it'll be positive, and hopefully it's something that we can do on an ongoing basis.
Anything else?
I have just a couple of things because it's timely on this. 2 things. One, the CJC project, which they're going to do the ribbon cutting for tomorrow. I mentioned that. It's a great project. The project is on budget. Okay, so congratulations to our team and Larry Dickey for bringing that in on budget. And it's a little bit behind because of COVID and shutting down out there, but it is on budget. And so 48% small business participation, that's huge. And Creative Contractors was a great partner and did a really, really good job. So giving them a plug also, So if you're not there, I just wanted to, because I know a couple of you are attending, some can't. The other thing, though, I wanted to make you aware of, when we're talking to our 3 senators this afternoon.
State senators?
State senators.
Okay.
And this is on a FRS bill. There's a bill, it's going to conference right now. You've got a House version, you've got a Senate version. The financial impact to us under the House version would be catastrophic. Would absolutely be catastrophic.
Tell them the number.
$36 million annually, okay? And so we have a significant issue here that they're going to go to conference. So I don't want to, cry wolf, but I want to understand their economic ramifications. There is no way to absorb that. There is no way to absorb that. It's significant. So there's 2 different versions. The Senate version doesn't have some of the huge cost impact issues, but I just want to
put it on your radar. We are talking to them, they're listening. And I've talked to the sheriff, and he's not as concerned, but again, we've got, it's not there, just because he thinks it's going to be settled at conference, but it's significant. So I had a conference call with all the county administrators around the state, and, again, it would be very, very significant for our county. And so I'm going to.
But correct me if I'm wrong, Barry, it's significant for all of the counties, isn't it?
All
Not
the
just
counties.
us.
This is
Yeah.
countywide. FACT is all over it, so Florida Association of Counties is all over it. County administrators are all over it. For small rural counties where they don't have the growth, okay, they don't see the growth in property values, not only would their rate, it would surpass what any rate would be if they kept the rate the same, it would be double what the rate would be. So they would absolutely have to cut into services, including public safety services, and or raise taxes. I mean, there'd be no other way of getting around that. So, every county's going to be different on how that, but the point being is it's significant. And since I'm calling senators to make that alert, I wanted to make you aware of that.
What's the driver behind the
biggest-
changes?
the biggest-
Why are they seeking these changes?
Well, it goes back to a pre-2011 when they made the reforms, of pension reforms. And the biggest cost driver is a 3% cost of living adjustment for retirees. That is a single driver of the cost increase. And so that would be, again, sometimes you think, okay, is it right? That way your retirees, keep up with inflation. Well, okay, but there's a huge financial impact to that. So that's probably the biggest piece of it. There's several different pieces. There's 3 main component pieces. That is the one that is has a significant
So is
financial
that going to be a recurring
Oh,
in
this,
the budget?
if this passed, it would be recurring every year, forever. So I'll be talking to them about it. Again, I just wanted to make you aware. It came pretty quick, and it passed pretty quick, and that's the reason I'm kind of, sounding the alarm bells.
Do we know where it originated from or who was driving it?
I don't have that information. I'm sure Brian does, but I think
It's
at
over
this.
there smiling.
Well, again, I don't think it matters at this point. It's driven. It's at conference, and and we've got to. I mean, so there's just a couple of days here where we have to impact it if we're gonna be able to do it. While we were here, Senator Hooper called me, so I'll be calling him back after this, and same way with Senator Roussant and Senator DeSigley. So.
I mean, that's why I was asking. There could be good intent by their thinking process,
Correct.
not understanding the ramifications completely, how that would affect the very residents they're trying to protect.
I think you're exactly right.
so-
There can absolutely be unintended consequences if, so,
Okay.
anyway, FYI. And then the last letter, I think, Commissioner, you were going to raise is the Sankey letter.
Yes, and Brian, I'm glad you stayed because things have happened so quickly on this issue. Is there an update since yesterday? Come on.
So no updates since yesterday. I did talk strategy with Harry Glenn, and I think the best route forward is we adjusted that letter that you have to reflect the decision that came from that we were notified of from Army Corps. Kelly's expecting a hard copy of that denial. So the suggestion was to send that letter to the White House Intergovernmental Affairs and then follow up with Julie afterwards, and maybe we'll have that letter by then from Army Corps.
Okay, and are we going to make a phone call or?
Yes.
Good. Okay, so did you all receive a copy of the letter and it's okay with all of you that we send it post haste? And then we're going to follow, Brian and I and Harry are going to follow up with a phone call because if you listen to Megan Ross's presentation about how this was having the potential and is already beginning to impact our sewer and water pipes, this is a this is turning into a real public health and safety issue. And given the tremendous change in the beach where the water comes up to the seawall, I can't even imagine what it would do on just a little ripple of a day or a small storm. So, yeah, this is not a joke. So stay tuned, and we'll get that out, right, Tony? Right away. Thank you so much. And if there's nothing else, then we are adjourned.